Hello student, in this video the complete review on the glutaraldehyde, so that the any question from this point, that is disinfectant on the glutaraldehyde, is covered, and the DMER exam is asking the question related to the disinfectant. So the all point related to the glutaraldehyde is covered in this topic. So the glutaraldehyde, the chemical formula glutaraldehyde is C5H8 and O2. IUPAC name of this glutaraldehyde is pentane 1,5-diol. Molecular weight is 100.12 gram per mole. Appearance is clear, colorless, pale yellow liquid. Odor is pungent and irritant. The classification is, the class is biocide, that is disinfectant, sterilizing agent. Functional group is dialdehyde, used as a high level disinfectant and chemical sterilizer. The mechanism of action of this glutaraldehyde is act by alkylating the amino and thiol group of the protein and nucleic acid, leads to cross-linking of the protein, inactivation of the enzyme, destruction of the microbial cell wall and membrane, DNA and RNA damage. This makes the effective against the bacteria, virus, fungi, spores, and even Mycobacterium tuberculosis, that is TB virus, TB bacteria. Spectrum of activity is microorganism type, effectiveness gram positive and gram negative both. Mycobacterium TB tuberculosis culocidal is action is cidal. Fungi and yeast fungicidal. Virus virocidal. Sporocidal. And the pharmaceutical and medicinal use is cold sterilization of medicinal devices, example endospore, catheters, dental instruments, disinfection of the hemodialysis equipments, used in the fixative of the histology, the tissue preservation, also used in the vaccine production to inactivate the viruses. Advantages are broad spectrum antimicrobial action, non-corrosive to metal, unlike bleach, penetrates the organic matter well and effective at the 2% solution. So it is 2% solution is effective. This is the very important point. Many time asked in exam. Next one is the disadvantage and toxicity. Highly irritant to the skin, eyes and respiratory tract. Can cause the contact dermatitis or the asthma like symptoms. Needs adequate ventilation and personal protective equipment. Required activation before use, buffered with bicarbonate. Preparation of this glutaraldehyde 2% is commercially solution is 2% aqueous glutaraldehyde activated by the alkalizing pH 7.5 to 8.5. Shelf life of after activation is 14 days. The brand name is Sidex and Sonacide. Time required for the action is the 20 minute, that is at 20 degrees Celsius. Sterilization 10-hour immersion. Tricks to remember this all the things which we have learned now. So the glutaraldehyde is terminator. It's give the name a terminator of all the microbe including spores, but only when given time long exposure for the sterilization. The important point from this topic and MCQ many time ask, use for the sterilization, non-heat required, requires activation, alkaline solution, not suitable for the living tissue disinfection, commonly used in the dentistry surgery. So thank you student. If you like this video, subscribe the channel for the upcoming same video.